We are going to have a fireside chat, but I don't think we want to fire. But I do believe, thank you, Tom, you've created a hearth of innovation here for us to have this conversation today. So I'd like to invite our three panelists to the stage. We're going to sit here and have a nice chat. We have about 45 minutes, and I really do want to make sure we get questions from the audience. So I'm going to be looking out there for long extended pauses at certain individuals if we don't get some questions, okay? I really want to get this dialogue going. So I'd like to invite Claudia Lucanetti from UT Austin Dell Medical School to the stage. Please join me in welcoming Claudia. Renee Yao from NVIDIA to the stage. Welcome, Renee. And Alex Arasi from Microsoft also to the stage. So I'm going to join them in the chairs, but first I'm going to just embarrass them a little bit with a description of the incredible talent we have together. This is an interesting combination. This is thought leaders in transforming healthcare. I'll talk about Claudia and her background a bit. Combined with what we have now learned is that there is an immense need for partnership with industry, both Microsoft and NVIDIA represented here. Claudia Lucanetti serves as Dean of the Dell Medical School and Senior Vice President for Medical Affairs at the University of Texas at Austin. In these roles, she oversees Dell's medical work in education, research, and clinical care, including operations of UT Health Austin. Dell's medical practice and leads the University Comprehensive Healthcare Strategy. She also holds the Frank and Charmaine Denius Distinguished Dean's Chair in Medical Leadership. She has a background in research in the neurosciences domain. And I do know her quite well, but indirectly through a partner of mine that I work with. His name is Rosanna Morris, our Chief Operations Officer. And Claudia and Rosanna are two powerhouses, and together they're shaping a new facility in Austin that is collaborative between Dell Medical and MD Anderson. So looking forward to your comments, Claudia. Renee Yao is the Director of Ecosystem Business Development at NVIDIA. Renee leads the entire business development ecosystem for healthcare life sciences, where she focuses on scaling partners and startups. And I had to adjust my ears when she told me the numbers. She manages a diverse portfolio, oversees over 4,000 healthcare startups in segments such as digital health, medical instruments, medical imaging, genomics, and drug discovery. And before that, she worked in developing bundles of technology within NVIDIA. Outside of NVIDIA, Renee has founded 6 startups in areas including healthcare insurance, fashion, AI toys, and more. So it's so great to hear you here with us, Renee, and also hearing your perspective about how the future of the way we work, where we work, from a care and research perspective, and what the demands NVIDIA is hearing. So super interesting. And finally, Alexander, how do you say your last name? Is Arasi or Arois? Ersa. Perfect. Yeah. There we go. Clarification. Feel comfortable in walking up to Alex in the future. With over 10 years of experience in healthcare industry, he heads up the product development at Microsoft Health and Life Sciences with a focus on medical imaging and multimodal foundation model development. Before being at Microsoft, he led a number of initiatives with Philips as Director of Innovation and Strategy Development. He also has a great post, or apparently it's his son's post, of him in front of, I think, 8-year-olds.
Yes.
Yeah, teaching them about AI in this classroom.
Yes.
So I'm interested, Alex, how you could compare your conversations with the 8-year-olds and us. Sometimes I feel like an 8-year-old right now. So before I sit down and join them, I'm going to ask them to step through, as I sit down and join them, I'm going to ask them to kind of tell us, maybe starting with Claudia, what did you expect from today and why are you here? Go ahead, Claudia.
Well, I think it's really an opportunity to look forward to the promise of AI and have a series of diverse perspectives on that. And when we're talking about AI, it's really not about AI's sake. It's really about creating a smarter, more human-centered, proactive, preventive, holistic, accessible, more integrated learning health system so that people can do what they do best, which is take care of patients, improve their experiences, prevent disease, improve the health span, and ultimately make the healthcare system better for all. And that's not a solo sport, that's a team sport. And I think the fact we've got a team up here and a team out there, the world is changing fast, faster than we can keep up. And the ability for us to bring our collective minds together to meet with the AI and that possibility, I think, is just an extraordinary moment in time. So looking forward to hearing more from my colleagues on the stage and learning from them.
Thanks, Claudia. Renee, what are your thoughts? What are you hoping to achieve here today?
Really excited to learn and share what we're seeing in the healthcare life science industry with supercharging by AI and a lot of various different technologies out there. And in particularly, a lot of these tools are to help accelerate providing better care for patients and closing care gaps. So hopefully after the panel, we can hear from a lot of you guys in hallway conversations and chatting about how academics, research, startups, innovation, and in industry can collaborate together to advance the future of healthcare, which is now.
Thanks, Renee. Alex, your thoughts? You can compare us to the 8-year-olds if you wish.
Oh, they literally grilled me there because it's a crowd of group, 8 years old, and they didn't have any bias about how things are getting done. And their interactions with the co-pilot that I had seen has been very creative because they're not really coming from legacy systems that are built around them to work with them. They're coming brand new to the field. Using the co-pilot was really amazing. But here also, yesterday, today has been really a very engaging experience to hear from the clinicians, researchers about what keeps them awake at night and how we can help them to come over those challenges as Microsoft was really enriching. And what I really would like to get a productive outcome today is making you guys aware of set of capabilities that can help you accelerate your AI journey. And therefore, I'm looking forward to very interactive conversations with you guys today during the panel or after the panel as well.
Okay, great. So today was supposed to be a really we had great foundational work yesterday, but I want to push this panel to the future. And I'm going to ask the audience to tap into your 8-year-old self, okay? When you're wondering about what that future looks like. So put away your biases and constraints about what we have to still keep doing and tap into that and think about that as you're posing questions. And I know a few of you, and I might call you out if I don't hear a question, so I'm just going to stress you a little bit, little bit of help. Okay. So when we build facilities like this, which is a beautiful hearth for innovation, certainly the promise of AI is in the minds of those who are starting to design this. But these things last for decades, these buildings. So I'm very interested in the perspective of the panel about how you're thinking about the facilities of the future that would be designed appropriately for this AI-enabled future. And I know, Claudia, you're working in this space, so I'm looking forward to that download. But I'm also imagining that there are architecture companies that are going to NVIDIA, for example, and asking, where are we going to get our compute? There are process-related initiatives going to Microsoft. How do we design? So maybe I'll go first with Claudia, because I know that you're having a lot of fun thinking about how this might work into the future.
Yeah, it's very relevant. We're really in the midst of unique and I would say once-in-a-generation opportunity in Austin of being able to partner with the #1 cancer center, MD Anderson, coming to Austin together with a greenfield opportunity at the University of Texas and Dell Medical School to bring two facilities together on site at this time of information, knowledge transformation. And so you need to be thinking about when Michael Dell says to me, well, Claudia, how are you going to build this and not be obsolete on day one, let alone what's going to happen 50 years from now, is the world we're in. And so it requires a couple things. One, where is the world going? There are some real trends, contextual shifts happening in medicine. First of all, it's becoming more distributed, which means care is being delivered everywhere, not just tied to a physical footprint. So you need to think about that when you're designing your facility. Second of all, you really need to recognize that it's fluid and evolving, and your structures have to be able to adapt to a world we haven't even yet seen. So number one, you have to begin with a digital-first mindset, enabling the infrastructure, whatever that is, from cloud computing to how you construct your hallways to accommodate robotics, automation, drones. All those elements need to be contemplated now with the anticipation that automation, robotics, it's already here, but it's only going to get on steroids and move faster. Second of all, you need to think about, in addition to the environment there, is how are you building for flexibility? You have to be able to be prepared for environments that are going to adapt and adjust. And so again, we think about and scenario plan. We go through scenario planning for the baseline to the transformative, and that has direct implications on the environment. But we have to make sure that when we scenario plan, we're thinking about the patient experience first and foremost, not just technology for technology's sake. So everywhere we begin in this purpose-built designing, we're thinking about the patient experience and how it's evolving. And then third, you really need to think about, in addition, the hardware, software are really being done together. You're developing environments where you have sensors that might be detecting fall risk today and might be detecting human emotional responses tomorrow. And you don't want to have to keep re-engineering, rebuilding. So these elements all have to come together. But the most transformative shift, I think, is the question where we're used to building facilities to provide care, and now we're really thinking about how does the building, the facilities become part of the care team. And in that mindset, you're thinking about how you're embedding the sensors, the biometric sensors, the devices, et cetera, and yet bury them into the background, so to speak, so that you can really focus on the empathy. The future world is about hyper-empathy. As machines and AI take more and more involvement, implementation, thinking about how you're building that element into this design. And then finally, how do you create the spaces where you connect with your humanity, with your nature, with light? All that gets built in. What ultimately happens, though, is with all the trends that are out there and the futuristic companies that are working alongside us, I think they had like a 300-page document telling us everything what could be. We need to narrow that down because at the end of the day, you need to make strategic bets. We know automation is a strategic bet. Preventative AI diagnostics, strategic bet. On-site manufacturing, strategic bet. Sensors and this environment, important strategic bet. And all those things will allow us to have the flexibility to respond to the future and have to be adaptable and flexible along the way.
That was amazing, actually, Claudia. Did you just say AI-powered empathic buildings? I think that's what you said.
In reality, yes, because think about the fact that if sensors can sort of anticipate in the room that a patient is fearful or afraid, or they're trying to get their nurse to tell them they need something, but something in the room has already sensed it before it's actually, and has been alerted to it before the problem begins. It is really weaving in hyper empathy in what we're doing. And that's human. And I would add the other part is, as you balance it out, the whole relationship of human to machine healthcare teams, we aren't ready for this transformation gap ahead of us. But the reality is it's here, it's coming. And so again, how do you embed that without it just overcoming and depersonalizing the environment? It has to be focused on enhancing the humanistic, empathetic side of the environment.
Okay, I'm going to Google AI. I don't know if I should use Google anymore, but you know what I mean. AI empathic healthcare, AI-powered empathic healthcare buildings. And if it's not already, cited, it's Claudia Lucanetti right there. Fantastic. Okay, so I can't imagine you see the power of AI coming. You see how you have to, and all I can think of is what's the compute infrastructure on the back end of this? And so, Renee, what are you hearing? Eventually that demand finds its way to some compute, and nobody does more in this space than NVIDIA and helps organizations make that transformation. So what are you hearing in this space?
Yeah, so first of all, NVIDIA is more than just a compute company. And that's a softball question because many folks actually hear us in the headline is that we build chips and are in gaming for quite some time. But we've actually been in the healthcare life science space for the last 2 decades. And the very first customers that we went in was GE Healthcare more than 2 decades ago. And for us, we do think that compute is going to power the next generation of research, healthcare automation. And the smart hospital of the future is going to be robotic, both physical robots and digital robots. So we have been doing quite a lot of work with MD Anderson, Mayo Clinic, Texas Children's Hospital, Atriums of the world to build the future of hospitals. These $5 billion bets in the future of building the future hospital will be both physical and digital robotic. What do we mean by that, right? In the physical robotics world, we are seeing the Da Vinci's of the world and Medtronics are building the future robotics for the surgeons to actually be able to perform the surgeries a lot more effectively. A lot of startups like Moon Surgical are able to get their robots through FDA approval within 15 months these days, from ideation to actually regulatory approval. And for those of you that are in the medical device space, that actually usually takes about 4 to 5 years, right? So a lot of that is not only just the software, hardware, but it's a full integration. And on the digital robotics side, what we're also seeing is a lot of the digital agents, AI agents, avatar, that's actually coming in to help reduce physician burnout, improve operational efficiencies. So a few of the specific examples that I could give. Earlier yesterday, you guys heard from a bridge, be able to document physician and patient's notes, saving physicians 3 hours on end, right? And more than 100 some hospitals already using a bridge. Other examples like Hippocratic, they use AI voice to be able to help navigate care for patients at home with the nurses to do pre and post-operative checkup. And also, let's say like Artisight, they actually able to do sensor fusion to be able to engage with the cameras and microphones in the hospital environment to be able to detect actually the beginning and the end of a surgery to schedule more surgeries coming in, or be able to figure out when do they need to go into the room to be able to turn over a patient, when do they need to change beds, right? Or even helping out with potentially even violence in the hospital environment when patients in pain in certain category, how do you protect the healthcare professionals, right? So those are all gonna be the future of healthcare that we're start seeing happening now. And many others not only just actually work within the health system, but they combine with the biopharmas as well. So Pangea Datas of the world, that they actually are helping closing care gap of being able to identify the right patients for the right treatment with drugs. So for example, Pangea Data is working very closely with many of the hospitals even here in Texas and also with like AstraZeneca's of the world to be able to help with rare diseases, identify more relevant patients that are underrepresented, undertreated to close care gaps. So for us, we're extremely excited that our supercomputers are powering the next generation of innovation in both the physical and the digital world.
Fantastic. To hear that the industry is sort of responding to the demand, not just in terms of the compute, but also the tooling, is exciting because it kind of moves me a little further along the hype cycle curve that we talked about yesterday, because it may suddenly converge to a much different experience. So very exciting. Alex, tell us about how Microsoft is sort of seeing, because like Microsoft is everywhere. I must admit this. I think it's even in my network sometimes, and some of my drives. It's everywhere, of course, we know that. So what are you seeing? What's Microsoft seeing in your work? How are you seeing this sort of new future for how healthcare facilities are designed and built? Love to hear your thoughts.
Sure. So I would like to start with a clarification regarding to where I sit within the Microsoft, because Microsoft, it's a huge organization, but I sit within the Health and Life Sciences organization under the Chief Science Officer team that we are working on strategic innovation projects for healthcare and life sciences, that we are working closely with Microsoft Research as well as Microsoft product teams and horizontal capabilities. And also we are allies into our collaborations like UT Health Systems to drive innovation that looks very far, but you need to start working on it today. And as an example to that, we are looking at innovation, healthcare innovation from 4 pillars: infrastructure, data platform, AI platform, and also application layer. And we are providing end-to-end capabilities that spans over those umbrella that as a research scientist or clinician or hospital systems, you can trustfully build healthcare AI applications or systems without leaving your own Azure tenant or without making your data leaving your own Azure tenant, so that you don't need to worry about any PHI, HIPAA compliance, and other things, because they are kind of giving out of the box as a capability. And from there, I would like to take the journey to the next level, saying that AI is going to transform hospital designs by driving core capabilities such as like smart hospital systems, predictive analytics and patient workflows, and AI-powered tools, and also on top of that, agents. And if we give a couple examples to that, how those 4 capabilities are going to reshape the hospital design, first of all, the smart hospital systems are basically an ecosystem that seamlessly connects EHR systems with medical devices, and as well as any imaging workflows, lab workflows, including building and resource management tools, so that you can do real-time monitoring. On top of that, you can triage the workflow according to like workloads that are running through the pipelines, but also more importantly, you can automate the routine tasks. As an example to that, we are working with multiple hospital networks across the nation to deploy Dragon Copilot, where you can use ambient and generative AI to create automated documentation. I mean, today it is based on the ambient recording and as well as generative AI, but of course, in the near future, it will be expanding its capabilities to also handle multimodal data sets, such as like different imaging data types and so on. If I go to the second capability, which is which is the like predictive analytics and patient workflows, it is very important to look at the hospital system where we are able to capture existing workloads, but also use AI to be able to predict what is going to happen next, and use that to triage the workloads effectively. As an example to that, we have been working with Johns Hopkins University to deploy AI in their ecosystem so that they can triage the workloads effectively, and today they are saving 70% of the clinician times by handling 500,000 messages every month through AI. And third one is the AI-powered tools. That is also one of the key pillars that I would say that will transform the hospital design. Because today, even though there's a generative AI capabilities are across the board, those capabilities like current state-of-the-art models are not able to reason when it comes to medical images or combining medical images with the text data. So the foundation models are going to be the key enabler, being able to infuse different data sets and handle cross-modality data sets at a given time without each person looking at individually in different times. What it will enable, for example, if you are using one of our foundation models, such as like MedImage Insights, it's a very strong embedding foundation model, you will be able to perform a pixel search. And what happens if you can perform a pixel search over your imaging data repo? Well, if you're a physician trying to identify what will be the best care path for a given patient, you can highlight a region of interest in a given medical image, and then your entire imaging repo, you can retrieve similar patient attributes of the images so that you can even look at retrospectively data-driven decisions, similar patients with the similar tumor locations, with the similar tumor size, what type of treatment plans they have gone through and what was the success rate, right? Or even you can take it to the next level, you can combine radiology image with digital pathology image to be able to understand risk survival rate of a given patient on a cancer case. Lastly, the agents, that will be the key enabler when we are combining smart hospital systems with like predictive analytics and the foundation models, multimodal foundation models. agents are going to be key enabler for any individual to be able to seamlessly and effortlessly access those capabilities, because agents are going to be facilitator and orchestrator of and working as expert for every individual to be able to ask questions, interact with multiple agents at a given time, to be able to reason over a complicated cases or even simple cases, from scheduling to pre-surgical planning to tumor board planning meetings. So that will be the kind of overall scheme. But I also would like to remind us what Peter said yesterday. For sure, AI is going to amplify good things, but AI will also amplify the risk. So in addition to all those 4 pillars, I also would like to remind that we need to be cognizant of active monitoring systems that sees through AI pipelines, agent pipelines, and ensures that those activities are executed under the responsible AI. And for that one, actually, we also have done a collaboration with MGB Hospital Network, where we have validated our multimodal monitoring pipeline that even looks at the pixel level to determine whether there's a data drift or model performance drift, so that you can flag those outliers actively and take precautions to make sure that your AI targets are staying within your threshold that you are looking for as effectiveness. So that will be the kind of how AI will change the hospital design in the future.
Thanks, Alex. Okay, I'm just looking, I don't see anybody at the microphones. This has been like a very rich breakfast buffet of great, new, and exciting ideas, and I'm sure there's some ideas bubbling up. I might call on somebody in the audience soon, so please go to the microphones. We really want questions. And we're going to go to like a short, brief conversations amongst ourselves. I'm just going to throw some things out. So feel free to ask each other questions. Shouldn't just all be coming from me, but here's one. Okay, so you just described an exciting new future, and we talked about it in the context of building new buildings or facilities. But what's this going to do to how we're organized inside the organization? And all I can think about is that when I saw Jensen talking about these neural processing units that are going to be in the inside of robots moving forward, and you mentioned robots, and you hear about this agentic activity moving around and interacting with humans, and I'm sure Michael Dell, as in like Dell Computer, who is keeping an eye on everything that's happening at Dell Medical, is also very excited about this level of technological integration. Who's going to coordinate that? What's the org chart going to look like, Claudia, for this thing?
I mean, I'd say before an org chart, investing in getting the talent around the table that can help us navigate this world. I would just say my own experience when I came after a whole career at Mayo and landed into UT Austin, the first thing I was thinking of, who's going to help us with data? Who's going to help us with infrastructure? Who's going to understand what we need to build in order to enable this world we're heading into? And it was a series of very deliberate efforts to bring specific talent to the table to help begin to move nimbly through this environment. The second is to immerse yourself into a world with expertise beyond your walls. Austin is a rich tech, vibrant environment. A lot of efforts just understanding where people are ahead of the puck, not chasing the puck. But you get to a critical point is organization and structure. And you need to create people who understand AI strategy at your executive level of your organization. You need to understand people who are thinking about AI implementation and some of the challenges around ethical framework, trustworthy framework. You need to invest heavily in cybersecurity out the gate and recognize that if you don't have that all the way up at the top of your organization, you have a problem. And you really recognize that IT isn't a service, it's a partner, beginning, middle, and end with what we're doing. And I think when you elevate that into the organization, you begin to have a team that's thinking about the practice, the research, the education, along with the people who implement. I mean, from the standpoint also, advisors. I mean, we've brought in, at the level of the leadership, external advisors who are thinking about these things and pointing us in places and challenging our assumptions. At the end of the day, though, implementation and how we're going to structure this inside of a hospital, I think it's evolving. The concept of a command control center that's connecting everywhere, where health is delivered not just in the physical environment, but into the home and out and about. I think we're sort of learning along the way, and I don't yet have that answer, except it's a very good question, and we better figure that out and look at early adopters, what they're learning, and begin to bring that into our own environment. I'm interested to hear what others think in terms of structural organization.
At NVIDIA, we don't have an org chart. So we have this.
You don't have an org chart.
It's actually, we don't have an org chart. If you try to map us, it's going to be very hard. But we do have this concept, which is mission as a boss. What we mean by that is that we actually swarm around a mission. A lot of people are confused with when I say swarm, so I'm going to take some time to explain it. Swarm, imagine it's like bees going up, zzz, like swarming concept. If you believe this is your big bet, then we deploy resources to swarm this big bet. And usually this big bet is, let's say that is a mission that we as a company care deeply about. Let's just give a specific example, sovereign AI. So Jensen did mention in many of the news outlets that sovereign AI is the future. For us, what sovereign AI means is that a country, an entity, or an organization in the future will be sovereign ready in the sense that they have their own data, build their own models, so solving local issues, right? Let's say a Japanese government will care more about the Japanese population with Japanese language instead of maybe deploying a Japanese language into Israeli environments that probably would not serve any Israeli populations like any good. So in that case, when Japan is getting ready for sovereign applications, there's compute data models and for the right local use cases accordingly. So how does that translate into internally? How do we organize when I say no org chart and mission is the boss? The mission is sovereign AI. And if you say that if all of us want to ensure sovereign AI is ready, within internally we have teams that are ensuring that the local compute organizations like NVIDIA Cloud Partners are doing amazing work. The ones that are working with Dell, working with Microsoft, are ensuring the sovereign entities are ready behind the scene with the right infrastructure. And there are teams like us, we're on the healthcare life science team, but in parallel we also have telecom teams and many other teams behind the scene that are getting ready for this sovereign initiative, right? So that means that we want to work with the country's Ministry of Health, identifying their local problems and surface up either the technology, the software tools to help the local population build up their developer ecosystem, and also work with the startups in the space globally to ensure that we can surface up the startups that can service the local population. And you can imagine even just what I just said, that actually, let me just quickly count. It's probably already 8 different teams across the board that are swarming our mission, sovereign AI, as the mission as the boss, sovereign AI as the boss. So we report to a mission instead of just reporting directly up the chain.
Okay, in summary, we heard about empathic buildings empowered by AI from Claudia. We heard about the mission is the boss, and we learned that we need to tap into our 8-year-old selves because we're thrown into this exciting future. So with that, please join me in thanking the panel for a very interesting discussion this morning.